All right, we've hit the 2-minute mark, so perhaps we can begin and people will allow others to trickle in. I just want to review a couple of housekeeping items before we begin. First and foremost, welcome to CNA's webinar on specialty certification. Please note that this webinar is being recorded and it will be made available online afterwards. Due to the large number of participants joining us today, please also note that the chat has been disabled. You can use the QA button at the bottom of the ribbon on your Zoom window to ask any questions at any time during the presentation. Note that the questions submitted during the presentation will be answered at the end. Great. So we'll begin our presentation today with a land acknowledgement. We, the Canadian Nurses Association, wish to acknowledge that the land upon which we are gathered today, for thousands of years, it has been the traditional land and home of diverse First Nation, Inuit, and Métis people. I would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of those lands. We are grateful to have the opportunity to work and play on this land. We pay our respects to Indigenous people, past and present, and reaffirm our relationships with one another. I make this acknowledgement with the recognition that we are a community of nurses that have a responsibility to learn the harsh and devastating impact colonialization has had on Indigenous peoples, past and present. My name is Sahar. I'm a registered nurse and hold a master's in public health with a specialization in health policy and management. My clinical practice area and areas of interest include specialty women and neonatal health, strategic policy, and global health research. Prior to joining CNA, I worked at the international level, the federal and provincial levels of government, and now work as the policy lead. I will be your moderator for today's session, and it is my absolute pleasure to introduce Misty Fortier. Misty is a registered nurse of 18 years with experience spanning various frontline and leadership positions throughout Canada prior to joining CNA. Her practice was focused in the acute care, where she was committed to quality patient and family-centered care and organizational excellence. Misty brings this experience and firsthand knowledge of the effects of certified nurses to healthcare organizations, to CNA, where she oversees the credentialing center, including certification program, as well as nursing policy. I'll hand it over to you, Misty.
Thank you, Sahar, and thank you everyone for joining us today and for your interest in our certification program at CNA. We titled this webinar to boost your nursing career and discover specialty certification. And what we really wanted to do is to address a lot of the frequently asked questions that we get around certification, eligibility, and how to maintain your certification. So what we'll be overviewing today is getting right down to the basics and the history of the certification program here in Canada. We want to talk about how our exams are developed, what the eligibility criteria are for certifications, when can you apply, how to prepare for your exam, how to maintain your certification once you've achieved a successful result on your exam, and is there any funding available? We're happy to take any questions, again, using the Q&A portion. And if any questions we're not able to get to them today, we will be addressing them through our online website if we aren't able to get them today. And you're also able at any time to reach out to us at certification@cna-aiic.ca, and we can address your questions individually. So we'll get started with what is certification. And really, defining certification is that it's a voluntary, recognized nursing credential that is offered by the Canadian Nurses Association. The credential has to be renewed every 5 years and confirms that a nurse has committed to a national standard of professional competence that demonstrates a comprehensive understanding of their nursing specialty area of practice. It's more than an exam. It's really a process to allow you to self-reflect on what you already know in your specialty, gain professional competence and ongoing best practices and skills as you move forward in your professional career. It's really key to note as well that certification is a program that was created by nurses and for nurses and really focuses on nursing skills and advancing the nursing profession. The certification program at CNA aligns with our missions and goals of strengthening nursing leadership, promoting nursing excellence and a vibrant profession, and to broadly engage nurses in advancing nursing and healthcare in Canada. We have a long-standing history with the certification program. In fact, it started back in the 1980s, believe it or not. At that point in time, CNA members came to CNA and asked us to explore the possibility of creating certification here for nurses in Canada. Lots of movement was happening in the United States with certification with the ANCC, and Canadian nurses wanted to have something similar offered here in Canada. From there, it did take us some time to explore what was happening as it was relatively new at that time. And CNA chose to become the umbrella organization for nursing certification in Canada. And we were able to develop the first exam in neuroscience nursing in 1991. Oops, sorry. That being said, we have to acknowledge the work that the Occupational Health Nurses of Canada did also in the 1980s, as they were actually the first ones to offer a national certification. But they were able to work with CNA when it was time to update their exam, and CNA did take over that program in 1993. Since the 80s, the program has grown and flourished over the last 30 years. We've built capacity and we've begun to offer exams in a number of specialties and areas of nursing practice. At its peak, we had 24 different certifications that were available, and we had over 16,000 nurses in Canada who had pursued, earned, and maintained certifications. However, in 2019, we looked at our membership and realized there was a gross gap in our membership, and we opened our membership to licensed and registered practical nurses as well as registered psychiatric nurses to join our members. And at that time, we'd also decided to offer new certifications. So certifications specific to LPN, RPNs in medical, surgical, and gerontology were introduced, and registered psychiatric nurses became eligible to write the psychiatric and mental health exam that we have. In 2021, we celebrated our 30th year of the program, and we continue to look at innovative ways that we can continue to grow over the next 30 years. Our program is unique, even in North America. We are the only bilingual program. We currently offer 19 certifications. It's considered a premier program internationally, and we're often consulted by other nursing certification boards and programs to share our expertise and best practices, aid in the development and certification in other countries around the world. Ultimately, when nurses become certified, and the reason we encourage nurses to become certified is that they're demonstrating a commitment to their career, a comprehensive understanding of their specialty area and nursing practice, a desire to challenge their knowledge and skills in the specialty at a national level, a commitment to personal growth, nursing excellence, and continuing competence, and a commitment to excellence in patient care. And when we talk about excellence in patient care, we actually have the verified data to support that statement. And these are things that we really, when we see the effects of the pandemic, we know the Canadian population was dissatisfied with the healthcare system. We see that nurses who are certified offer improved patient safety and outcomes for our patient population here in Canada. And of note, we're able to see a 2% decrease in the odds of mortality and failure to rescue for just an increase of 10% of certified nurses on any one unit. And we can see these numbers really get impacted with even just small numbers of certified nurses. For example, we have seen significantly lower rates of falls in units that have 2 or more geriatric certified nurses. Only 2 can make such a unique difference for those patients' lives. We see lower rates of central line related infections in ICUs. And we also see overall length of hospital stays reduced by even just 1 day, with only a 6% increase in certified nurses. Additional impacts that we have seen is in patient satisfaction, and that there's actually an increase in patient satisfaction by 2.5 points for patients that are cared for by certified nurses. And we all are well aware of the HHR crisis we're facing right now in Canada, and certification has actually shown to affect the reduction of hospital nurse turnover by 16 to 8%. That is a huge difference when there is an increase of certified nurses. So it's really something to pursue. Not only impacts our careers as nurses and develops the profession, but also impacts the care that we're giving to our patients. We're proud to continue to offer 19 exams for registered nurses, nurse practitioners, registered psychiatric nurses, licensed practical nurses, and registered practical nurses. We do have some exams that unfortunately had to be retired. However, those nurses who did earn that registration are still able to use that designation through continuous learning applications, which brings us to a total of 22 exams that are currently active. 19 exams that are currently active and 22 current certifications. Next question we often received is questions about our methods and how we develop our exams here at CNA. And it's really a three-phase process. The first phase is really the designation for certification. And this is where it's brought to our attention or an assessment's completed by a CNA team to determine if there is a need for a new certification. And this proposal would outline the specialty that is desired, the number of nurses it's estimated in Canada that practices that specialty, and if that specialty has a unique competencies and skills that are required in order to practice it. From there, the CNA team would review those proposals and determine if there is a viability for us to be able to move forward with an exam development. Phase two, we're going to get very deep into the next slide, but it's really when we start developing the exams. The decision is made that we're going to move forward with an exam development, and we use a very extensive process with a partner who is an expert in examination development and psychometric testing. Once the exam is developed, which can be a multi-year process, we move into phase three, where certification exams are offered to nurses and they begin their journey to certification and renewal. As I said, I wanted to talk a little bit more about our exam development because that's really where a lot of the questions come from. We work very closely with leaders in exam development and administration. Their name is Measure Learning. They are a previously Canadian company, but also work quite a bit with other North American countries. And they use an extensive and comprehensive process involving nursing subject matters to develop proposed exam specialties and exams that are being developed. The first stage in our exam development actually doesn't have anything to do with the exam at all. It's the development of national standards by nurse experts in the specialty from across the country. Start to finish, to develop an exam, we require at least 50 RNs or nurses to help us develop those exams. If it is an RN only exam, we use 50 RNs. If it is an LPN, RPN exam, we would use LPNs, RPNs to act as those subject matter experts. Many more are often required for regular maintenance activities that happen to the exams that occur on a very strict schedule. When you're certified, we do offer opportunities for you to volunteer to help with this exam development, be a mentor, or to support study groups. Like I said earlier, certification exams are created by nurses for nurses. And as we gather these specialty nurse experts to help develop these national standards and competencies, we are really looking for a diverse group of individuals that are representative across Canada from varying cultures and experiences, as well as being bilingual. So having both English and French voices at the table as we begin to develop these standards and competencies. Once we have a very robust list of standards and competencies for nurses practicing in that specialty, we bring together the committee again to develop related test questions. And this is really where Measure Learning comes into play, as they offer their psychometric support, as well as the nurse experts providing us the content to develop those test questions. In conjunction with those test questions, we also develop exam prep resources, such as a practice test, and a bibliography of references for nurses to be able to access in order to prepare for the exam. Many of our national nursing specialty partners work with us in these steps, and they also have been, some have been able to provide other resources that will help with study guides for examination prep. Once the exam is completed, we administer the first exam and evaluate and adjust the questions as required. From there, each exam takes on a life cycle over 8 years to ensure that it's maintaining its competence, it's maintaining its currency, and that the competencies haven't changed. So we do revisit and require volunteers throughout the life cycle of every exam to ensure that we are creating the most up-to-date, current, and evidence-based exams that are meeting current standards in Canada. There are multiple steps that we expect a nurse to take as they move through certification once the exams are created. Number one, we do advise that every nurse joins CNA. We think it is a good benefit. It does give you additional supports through our communities of practice and access to other certified nurses who have had the similar experience and that you're able to talk to. There is a restriction to our exams that they must be taken by regulated nurses. So unfortunately, our exams are not open to student nurses at this time, and nurses who are taking the exams are expected to have worked and have experience within the specialty that they're applying for. Most nurses end up making some connections with other certified nurses or other nurses on the journey to certification before they apply to determine if they want to. Once they have made the decision, there is an application process that they would go through, and then a period of time where they're able to prepare for the exam. Once the exam is taken and they have a successful result, they would move on to the renewal phase through that. We're going to go through this whole process a little bit in the next few slides, just going deeper into each of these sections and how they may help you move through your certification journey. The first area we're going to touch on is the eligibility criteria. So are you eligible to write one of our certification exams? Eligibility criteria for our exams is the same for almost every single exam. There are 2 streams of eligibility. You may choose either one in order to apply for a certification exam. First option is option 1, where you would apply with only experience. And so in order to apply with experience, you would need to have 1,950 hours worked in the specialty over the past 5 years. You are able to forecast how many hours you would have at the time that you would write the exam. So if you're coming to us and you say, I only have 1,900 hours, I have 50 hours booked in the next month, and I don't write until May, we would be able to approve your application based on that. Option 2 is experience in education. And we know that there are many courses out there available for nurses to get that added knowledge and experience through education in a specialty, whether it be obstetrics, operating room, ICU, critical care. Once you have completed a specialty diploma or certificate of 300 hours or more, and you have 1,000 hours of worked experience in the specialty, completed within the last 5 years, you would also be eligible to write most of our exams. And the reason I say most is that we do have one exam that is an outlier, and that is with our wound ostomy incontinence certification, which does require that the course that is completed is an NSWAC course with wound ostomy incontinence focus. So that is our only course that does have an alternative eligibility criteria. But again, if you have any questions about that, please reach out to us. When it comes to eligibility criteria and the hours worked, we do get a lot of questions. Many nurses we know don't traditionally work in the bedside positions that they would have worked in 20 years ago, or they've moved on to a manager position, for example, and they wonder, am I still eligible to apply for certification? The answer is yes. When we look at nursing experience and worked hours, what we're looking for is any nursing experience within the following 5 domains. Direct patient care being number 1, and that is where most of our nurses end up gathering a lot of their hours. However, it's not the only area where you get nursing practice and nursing experience. We also look at education. And to be clear here, I'm not speaking about taking education. I'm speaking of being a nurse educator. So nurse educators who are educating within a specialty area would also be eligible to use those hours to apply for certification. Same as nurse researchers doing research within a specialty would be eligible to apply, as with policy, as with any nurse in an administrative or managerial position. If you're still working within that specialty and have knowledge and access to evidence-based practice and opportunities for learning in a specialty area, you would be eligible to apply for certification. Once hours of experience in education are established, there are some other certification eligibility criteria that are required of all applications. The number one being a current registration or license to practice nursing in Canada. You must meet the experience or education requirements. We also request that you provide us the contact information of someone who can endorse your statements within the application. And this could be a supervisor or consultant within your specialty who's able to confirm the statements you made about your specialty experience and endorse the application. We need their contact information because we do reach out to these individuals to confirm that what you've said in your application is appropriate and that it does meet their understanding of your experience. And we also require that your exam fees are paid at the time of application in order for us to proceed with your registration and getting you set up for the examination. When can you apply to write the CNA certification exam? We administer exams twice per year for all specialties and areas of practice and in both languages, English and French. All exams are computer-based. So we do offer remote testing. So anyone from Nova Scotia to Nunavut to Vancouver who has a computer and a high-speed internet should be able to write their exam from the comfort of their own home. We know that's not ideal for everyone, so we also have 60 plus test centers available throughout Canada. It does have to be stated, though, that space in our test centers is limited and they do fill up quite quickly. So if you're choosing a test center option, just be aware that it is not guaranteed and you may be required to move to a remote testing. Important dates for 2024 is that our application windows are opening January 15th, which was yesterday, and will be open through to March 31st. This is called traditionally our spring window, and these individuals who are registering through to the end of March will be writing their exams anytime between May 1st and 15th. We say anytime because you will be getting information on when to book, and the date that you write the exam ultimately is up to you and the availability of the exam. We open again our window June 10th through to September 30th for our fall cycle of exams. Those individuals will be writing their exam between November 1st and 15th. The exam itself is a 3.5-hour exam and is made up of approximately 160 to 165 questions. Each exam is unique based on the competencies and the questions that are developed by our subject matter experts, and that's why we're giving you a range. The types of questions that are encompassed in our exam are all multiple choice. So you'll have a STEM, which will provide you some details, and then 4 possible answers. And we are asking you to select the best possible answer. The exam questions are practice-based. It's designed to test the knowledge and skills expected of a nurse with at least 1 year of full-time experience in the specialty or area of nursing practice. The multiple choice questions will either be presented as a case study and then followed by multiple choice questions related to that case study, or it may be independent questions that give you some details within the question and be one question in and of itself. You are never going to have a question that has the answer all of the above. You're also never going to have a question that asks you to select one or more answers. And one question will never lead to the answer for the next question. They are all encompassed within themselves. Exam questions are based on knowledge comprehension, the application and critical thinking aspects of nursing. So for knowledge and comprehension, we're really testing your cognitive ability to recall learned material, to understand its meaning, select the correct facts, concepts, or principles or procedures. These questions will make up anywhere between 25 to 35% of the questions that you're asked on the exam. Under application, it is a practice-based exam, and so these questions will test your ability to apply knowledge in providing patient care, applying the rules, methods, and theories, and to identify consequences. These will be 35 to 45% of your questions and will be the bulk of your exam. Critical thinking questions will be problem-solving questions, which will test your ability to interpret the data, deal with the abstract, evaluate options, and problem solve. And these will be 25 to 35% of your questions. Next most common question we get is, how can I prepare for my exam? What do I study? The best preparation for the exam, I can tell you, is clinical practice. So working in the area of your specialty, working with the patients who are within that specialty, and really examining the skills and knowledge you need from a day-to-day basis and able to work within that specialty area. There is no one core curriculum reference or book that I can give you and tell you to go and study. We do offer online resources that help direct you in the right area to go find these books. But for each exam, there is a list of specialty competencies. So each exam has had a subject matter expert group come together and say, this is what this nurse needs to practice in this specialty. It is unique for every specialty. So each of the 19 exams have their own competency document, and it will break it down into individual statements of what you need to know to operate as a nurse in that specialty. Each exam also has an exam blueprint, which is a full breakdown of what the exam is, the breakdown of the questions. Previous slide, I talked about 25 to 35%. It will tell you what percentage is on your exam. It'll tell you exactly how many questions are on your exam, and it'll tell you the breakdown of questions per competency. We also provide a bibliography list for each exam, and these are a list of resources that the subject matter experts use to develop the exam. It is a very good source of reading material for you to study for your exam. It is an extensive list of reading material, so there can be upwards of 20 books on that list. We do not expect you to read all of those books. We expect you to identify where your learning needs are and to identify which books most meet those needs. We also offer an online practice test that you will have access to once your exam registration is processed by our partners at Measure Learning. We also have available on our website a list of mentors. These are people that have already gone through the certification process and have some keen insights on how they prepared to study and successfully pass their exams. We also have a list of study groups, and these are individuals often led by a mentor who are coming together to study together for the exam. There is also additional support offered from some of our national specialty group partners, and I do encourage you to check them out based on which specialty you're looking for, as they all have an association, a Canadian-wide association, and many have resources developed for these specific exams. Many have participated as subject matter experts in the development of our exams. On the previous slide, I talked about the specialty competency documents, and I've mentioned it a few times already in this presentation. It really is the key document that's going to guide your study. I've left the website here where you can find them. You would simply go to this website and click on your certification specialty, and the document will be displayed. What's really key as you study for your exam is to focus on common evidence-based practice, not unit specific. We know that each unit has cultures that develop in certain ways that they do things that may not be best practice. And we really intended the focus of these exams to have a national scope, and common evidence-based practice is key as you go through the questions and answers. It's really important as you go through the practice competencies to identify where are you struggling, where are your gaps in knowledge, what are you familiar with, and what areas of the specialty are you unfamiliar with. It's also key to understand new vocabulary and key definitions that you might not use in your day-to-day unit practice that might be used as common practice throughout the rest of the country. Competency documents and the examination blueprint will help you perform self-assessment with those questions of where your gaps are, what do I need to study, what can I brush up on, and what might I already be an expert in. I have an example here of one of the exam blueprints, which is a great resource to be able to know and be prepared for what kind of questions are going to come at you on the exam. So in this example, this is a critical care adult nursing exam guideline where there's approximately 165 multiple choice questions. We know that 60 to 65 of the questions are going to be independent and up to 40% of them will be case-based. We know how the breakdown between knowledge, application, and critical thinking will occur. And we can also see the competency categories. And this is where it becomes key. If you are an expert in end of life and you frequently read journal articles and recently published literature on end of life care in critical care, this might not be the area you need to focus on. However, you may have less experience in the neurological system, and that's the foot play area that you would like to focus on, and that is where you would concentrate your study. These documents, all available on the CNA website, will be your guide for you to know what you need to study. As you go through those competencies, review each of them individually and perform an honest self-assessment of where you feel your understanding is in that area. It's helpful to rate each competency according to your level of competence. Determine what your priorities are for your study plan based on this assessment and based on what percentage of the questions are going to be on the exam from the exam blueprint. Once you know where your gaps are, it's helpful to create a study plan. List all of the topics you'd like to review and create a realistic study schedule to address each of them. It's always important to study your weakest subjects first, but try to stick to a time limit. And it's also important to note that it may be helpful to seek out those weak skills that you may have on your unit. If you have a peer who has a skill coming up that you haven't practiced in a while, it may be an opportunity for you to volunteer and take that on just to brush up on some of those skills. Overall, we encourage you to plan to complete your study guide at least 2 weeks before the exam date to give you some time to rest and recuperate prior to the exam, as well as some time to do an overall review instead of focusing on specific competency areas. Ultimately, you just need to get started. Complete the practice exam test. That always helps you test your baseline knowledge and to know where you might sit if you were to write the real exam. Review the theory, best evidence and practice recommendations for each topic. And again, focus on the national standard versus your local expectations or experience. And we do encourage you to repeat the practice exam at the end of your study plan to reassess your overall preparedness. For the practice exam, you will have 20 chances to write that practice exam. We don't want you to use it as a mark of your pass-fail for the actual exam. The questions are different and you can get a dependency and you will become familiar with the questions on the practice exam. So just use caution in the frequency in which you use it and the reliance you have on that practice exam. Before exam day, the first thing I've put here in highlight is ensure you have read all of the emails sent to you by Measure Learning and or CNA. You will get a number of emails from both organizations. They are all important and they all have key information that will help guide you for booking and writing your exam. And I cannot tell you how many questions we have from individuals reaching out unsure of what to do or who had deleted their email or has questions that would have been covered within those emails. Those emails have all the information you need to be prepared to write your exam on exam day. If you are writing in person, know where you are going And I know that sounds silly, but a lot of our testing centers are actually within other institutions and universities. And there may be a specific entrance or street or parking that you should have used. All of these details will be provided you by Measure Learning, but it is helpful to have a map or to have copies of those emails with you so that you know where you are going when you are writing in person. If you are writing online at home, we do ask that your computer has passed the Measure Learning computer test. So this is a feature called Test It Out that you'll, again, within an email, we'll get a link to it. And you'll be able to test your computer to ensure that it has the speed, memory, and processing power to ensure that you have a seamless exam writing experience. I do have to say, if you do not do the Test It Out feature, and you have issues on the day of your exam, you may be responsible for incurring some fees for rebooking if they are unable to troubleshoot your computer issues the day of your exam. If you have done your Test It Out feature and you still have problems the day of the exam, you will not have any additional fees incurred that day, and we will ensure that we get you rebooked. Another key point that sometimes delays exams on exam days is that you should download Measure Learning's Guardian browser in advance of the exam. This is just their unique browser that they use to ensure the safety and protection of their proctors as well as the students that are taking their exam. The third thing we should do before exam day is confirm your webcam and microphone are installed and functioning. By doing these three things, you're going to ensure that you have a seamless exam morning when you first log in to start your exam when writing from home. When the day of your exam comes, you do need to bring photo ID. Regardless if you're writing from a test center or from home, the person who will be invigilating your exam will need to verify you are who you say you are and will need to see your photo ID. This can be any government issued ID, including a provincial health card if it has a picture associated with it. Do not bring your pen, paper, calculator, or phone into the exam area. And this goes for both in-person testing centers or if you're testing from home. No additional items are allowed to be brought into the exam space. And if you are writing from home, you will be asked to pan the room to ensure there's no other people in there, that you don't have papers on your desk or any other items that may impact your exam writing. As you start the exam, be aware of the time, and really, you need to be confident in your knowledge and skills. You know your stuff, you're going to do great, and just be confident. On the day of the exam, we often get emails from nurses who are in a state of panic because it did not go as planned. And these are the minority, but we want to let you know, do not panic. If you are experiencing a medical emergency, if you go into childbirth, if you have severe weather and can't drive, if you have an unforeseen power outage in the middle of your exam, or if you have computer issues that were not caught during Test It Out, we have plans in place to help you. The key factor being you need to let us know. So you need to contact us. So you always, with any issues, contact Measure Learning Support at the number below. You will get this number in every email you receive from Measure Learning as well as from CNA, encouraging you to reach out to us as soon as possible. If you reach out to us 2 weeks after the exam window closes, we cannot help you then. We need to know as soon as possible. If you are unable to write your exam that day, we will make efforts to ensure that you get rebooked before the end of the exam window. So again, do not panic. Let us know, and we will work with you to get it resolved as soon as possible. Once you completed your exam, you will not get a successful or unsuccessful result right away. You will get it within 6 weeks of the exam. If you are successful, you're permitted to use your designation after your name immediately, as illustrated below here with Timothy Nurse. And we ask that you do start using it right away, and you can use it with any signature as you are officially a certified nurse once you have passed your exam. We will also be mailing you a certification pin and a certification certificate at a later date. The certificate will have the emblem right here in blue and white, as well as the pin is this gold item here. So you'll be receiving both of those, and we do hope that you display them proudly for everyone to see your new designation. Unfortunately, we do have a few that are unsuccessful during our examinations. We do want to let everyone know that unlimited rewrites are offered to anyone who is unsuccessful, and there is a discount for a rewrite fee. Nurses who are unsuccessful will not only receive a letter with their mark, they will also receive a report on the scoring of their exams, including of the percentage of correct answers per competency. So they'll really see which areas they needed to brush up their studying on, which areas they struggled in order to help support them as they make the decision if they want to continue to pursue certification and have a rewrite. We have an extremely high rate of successful rewrites who choose to move on using that study guide that is provided to them post their unsuccessful result. We often get questions asking to review their exams and the answers that they gave to them. I do have to tell you, we never are able to release those exam questions. As I stated before, they are rigorously developed and only updated at certain times throughout the year, and we are not able to share those exam questions with anyone in any format. So if you are unsuccessful, we will be unable to provide that service to you. We will work with you to help identify what areas you need to focus on. Once you're certified, how do you maintain your certification? Certifications are valid for 5 years. To renew your certification, there's a few steps you need to take, and they're very similar to the initial application. You need to first pay the renewal fee. You need to complete the renewal application. Within that application, we will ask that you have completed 2,950 hours of nursing experience over the past 5 years in the specialty for which you are renewing. Then you have a choice. You can rewrite the exam if that is your preference. That is not the most common preference, but we do offer that as some people prefer to write the exam. The other option is that you could have completed 100 hours of continuous education and learning in your field of specialty. To be clear, that's 100 hours over 5 years or 20 hours per year. You could do all 100 hours in your 3rd year. It does not have to be equally spread out through all 5 years. It just needs to equal a minimum of 100 hours over the past 5 years. You may start that continuing learning the day after you get your successful result on your exam. There is no requirements there. If you want guidelines as to what is applicable, examples of continuous education or learning, please visit our website under Renewing Your Certification, and there is a full and comprehensive list of what hours you are able to and not able to claim to maintain your certification. I will say most nurses do not struggle to achieve this 100 hours just based on internal education that they receive in their day-to-day work. But I do encourage you to review that to ensure that you are able to maintain your certification in your field of specialty. People often ask us, is there funding available? There is, believe it or not. The first thing I wanted to review is that by joining CNA, you already incur savings on your certification. CNA members save $186 on initial certification fees and $103 on renewal fees, which more than pays for their general membership with CNA. And it's something that we really encourage you to consider, as it is an opportunity to participate in members-only benefits, as well as to participate in our communities and to glean that knowledge that you can get from our other specialty nursing associations that are in partnership with CNA. We also have a collaboration with the Canadian Nurses Foundation, who have a series of certification awards. This is an annual distribution of more than 30 certification awards. The eligibility for each award varies, but I can tell you it's very broad, and it is very likely that you apply for one of them. All applicants who apply for these awards must have successfully written and passed a CNA certification exam in the application calendar year. So these applications open in the fall, and you can sign up for notifications for them at any time. They are awarded in March of the following calendar year. We also offer an employer voucher program. If you wanted to go to your nurse manager or nursing administrators and advocate for their support of your certification, we do offer these at a discount to organizations looking to purchase these for their nursing staff. We do require that there is a minimum of 15 purchased at a time. And how it works is we essentially give them a coupon code or an exam voucher code that they can distribute to their staff who are chosen to participate in the program. Eligible nurses then just follow the typical application process for the exam and would enter in that coupon code when they are asked to pay. And the code is valid within 12 months of its original purchase. So we do have a number of employers that are looking for ways to support their nursing staff, and this is an option that is available to them. There are some other sources of funding that many people don't think of. One being collective bargaining agreements. In many collective bargaining agreements across Canada, they've included monetary subsidies, whether it's a one-time education payout or hourly stipends for nurses who have undertaken additional certifications in education. In some areas, these can be as high as $1,000 a year. So we do encourage you to check with your local union and your local bargaining teams to see if this applies to you or if there's a possibility of including it in their next agreement. The National Specialty Associations. Many of the National Specialty Associations have funding available for nurses who have successfully passed their certification exam. I do not have a fulsome list of this. However, what I do know is there's times where this money goes unclaimed. So do reach out to your National Specialty Association to see if this would apply for you. Ultimately, are you ready? It's really time to be certified. We want you to boost your confidence by validating your specialty knowledge, nursing experience, and clinical judgment. Be recognized by your peers, employers, and clients. Set yourself apart with a market distinction and enhance your opportunities. We know that employers would preferably hire someone who's certified over someone who's not certified if everything else on their resume is identical. It will set you apart. Showcase your commitment to lifelong learning and your passion for quality of care. Applications are open now through March 31st for testing May 1st to 15th. If you have any questions, please forward them to us at certification@cna-aiic.ca, and we'll be able to answer any questions you have about eligibility, the application process, or the exam process, and we hope to see you soon. Thank you, everyone.
Thank you so much, Misty. We've gotten questions as you have been speaking, and I'll go over them with you right now. Our first question is, what exactly is the hours requirement and how long do I have to complete them?
So if we're talking about the eligibility requirements to write the exam, we want the hours to have been worked within the past 5 years. So if you were to apply for the exam in 2024, you would have had to have had those working hours between 2019,
18.
2019 to now, through to 2023, for you to be able to work that to enter those hours. If you're referring to the 100 continuous learning hours, you have 5 years to amass those as well. We do ask that you keep a record of them, and you will need to submit that record of your continuous learning hours to us.
Thanks, Misty. Is the hours requirement to be met at the time of registering for the exam or by the time you write the exam?
So it's by the time you write the exam. You can forecast that you'll have the hours. I do have to say though, the more hours you have, the more the higher level of success rate we see. So there is a correlation there. So if you're just shy of hours, you can predict that you'll have the 1950. If it's an honest prediction, we may reach out to you or your endorser to confirm that prediction will be accurate to the day of your exam. Or would encourage you to consider waiting for the next writing of the exam, as more experience is correlated to a successful exam experience.
Our next question is, if I work on a unit that's medicine and palliative, can I apply for a palliative certification?
Yes, you can, as long as you still have that 1,950 hours that can be associated strictly to palliative care. There are some cases where you're actually eligible for a dual certification. And if you're on a medicine palliative unit, that may be one of them. You may also be eligible for a medical surgical certification.
So we have a participant who's employed in private practice and does not have a supervisor. How would she address this part of the application?
So that does happen. If there is any nurse who works with you in at an equal administrative level, or if you have a physician, for example, that may also be used as an endorser. If you have someone specific in mind who can confirm your experience, please reach out to certification at CNA AIAC.ca, and we can verify whether or not your endorser is appropriate or not for you.
Perfect. Our next question is from Tamara. I am in an administrative role. How are questions developed that encompass this aspect of nursing?
So it really is going to depend on the competencies that were developed for your specialty and if leadership was listed as one of those competencies. I can tell you CNA's plans for 2024 is to have a leadership certification. However, it's going to be tied to a new education platform that we have with the Canadian College of Health Leaders called Inspire Nursing, and only graduates of that program will be eligible. So if you want more information on potentially a leadership certification, please let me know. Otherwise, it really depends on the competencies that were developed for that specific specialty practice.
Thanks, Misty. Our next question is from Nancy. Will you consider a different renewal formula for semi-retired certified nurses who do not meet the practice hour requirement and who would rewrite the exam if it hadn't been discontinued?
I don't have full details on that yet, but yes, that is under consideration right now.
Okay. I think that brings us to the end of our, oh, okay. I think that brings us to the end of all of our questions. I think there are a couple that our team is working to respond to, but let's see if anybody else has a question. Otherwise, we can wrap up.
All right, thank you everyone for joining. We truly appreciate it. Oh, I see a hand.
Oh,
Oh, I don't know. Are we able to let them?
yes. Oh, I see Jacqueline has put her hand down. Lisa, one moment. Go ahead, Lisa, you can unmute.
Sorry, I did not mean to do that.
Okay.
Oh, no problem. Jacqueline, please go ahead.
Thank you. Can you hear me?
Yes.
Yes.
Thank you. Yeah, and I just want to say, Misty, I think everyone should be a part of CNA too. And I don't get a commission on that, but I do encourage it for sure. I just had a question before I joined you, and thank you for presenting this information. It's very valuable. Before I joined, I paid my application fee, and I want to test in person here in Calgary. So I put that in when it says to add that I wanted to test at an in-person center anywhere from May 1 to 15. When will I know what dates are available at those centers, or will someone be reaching out with me with availability in that time span?
Yeah. So I believe, and Margarita can correct me if I'm wrong, I believe it's the first week of February. We start sending the names to our partners at Measure Learning, and they administer the exams for us, and they will be reaching out with more information. To book in person, I do believe it'll be a little bit later. I don't know the exact date off the top of my head, Jacqueline, but we can reach out to you and let you know.
Okay, thank you.
No problem.
Okay, great. So another question from Nicole. How do you find rural ER nurses fit in writing the ENC? We see a lot, but certainly not the numbers a regional site would.
We do have a number of remote nurses who do, or rural nurses who do write the emergency nursing certification. And again, that goes back to your personal knowledge. I would argue that you may see a little bit more than what some of the other inner city ERC, just from my own personal experience in both. Because there are traumas that you guys are managing and stabilizing prior to transferring out. So it would come back down to reviewing those competencies that were developed and identifying where your own gaps might be, and doing what you can to study them. But we do have a number of nurses working in more rural areas who are still successful in writing the exam.
Great. A question from Sarah. I'm an NP in geriatrics and I do not have a direct supervisor. Can I get a colleague to certify my hours?
Yes, you can, Sarah. So a colleague, either who works with you or alongside you, or again, if you have a physician colleague who also works with you that may be able to verify your hours, is all acceptable. And again, if you aren't sure, it's better to reach out to us to verify it. And we can flag your application so that we know who we will be expecting that endorsement from.
All right. Thank you, everyone, for attending. Seeing no more questions in the QA section, I think we can wrap up. You can expect to have this recording available online, and the presentation slides will be made available at the same time. Thank you all for coming. If you do have any additional questions, please feel free to email us. And I think that's a wrap.
All right. Thank you, everyone, for joining us, and we hope we see you writing with us soon.